Congress is back home for recess, but that doesn't mean that work is stopping on the NDAA. Joining us is Jen to talk about how we're advancing our agenda during this time.
Yeah, so the National Defense Authorization Act, the annual bill that we're tracking, is already through both the House and Senate Armed Services Committees, which means now it's ready for floor action. But in the meantime, while Congress is back at home, the professional staff members, the PSMs, are continuing to do their work on it. So MOAA just wrote a letter not only to those professional staff members, but to all the members of the Armed Services Committees to talk about the items in each version, whether it's the House or the Senate versions of the NDAA, that we want to make sure make it into the final bill. So tell me about a couple of those provisions.
Yep, that pre-conferencing work is really important. And one of the provisions that was included last year that got pulled out is the TAP Promotion Act. And what that does is that gives VSOs like MOAA a seat at the table to help assist service members that are leaving access their health care and benefits with doing things like filing their disability claims. So that really helps bridge the gap. The other provision is the family separation allowance is being increased to $400 a month. Before, DoD had a window between $250 a month at $400, and this just straight increases it. So those are like a couple of things I'm watching in the House version. What are you looking at?
Well, still in the House version are two things that we're actually tackling right now with our summer advocacy in action. And those impact service members and dependents who need OBGYN care. One of those provisions allows OBGYN care without that referral from your PCM. The other one would allow pregnancy to serve as a qualifying life event, to allow you to change your TRICARE from prime to standard or vice versa in the event that you become pregnant.
House is one side of the coin, but the other side is the Senate version. And one of the things that I'm looking closely at is BAS. So what we have as a priority that we're flagging to make sure included is a technical fix, which doesn't sound very excited. But what it does is make sure that for service members, every year when your BAS is adjusted, it closes a loophole that will allow it to be decreased, which we don't want to see anybody's money for food get downsized.
No, especially as food insecurity continues to be a challenge. One of the biggest provisions that I was pleased to see in the Senate version is a requirement for a report on unmet needs for child care. Child care continues to plague the nation, and DoD is not an exception. So what this will do is actually identify not only the long wait lists that we have at installations, but what kind of child care military families are using or waiting for. And it's important to track and measure these things in order to actually change them going forward. So that's a really necessary report.
So there's a notable item that is absent, but certainly not forgotten. That's the STAR Act. Can you explain why that wasn't included?
So the MOAA's letter on the NDAA only included things that were in the base text, whether that was the House or the Senate versions. The STAR Act was actually added as an amendment on the Senate side. So it will continue to be a priority. It just didn't make it into this letter.
Okay. If you want to make sure you're tracking everything related to the NDAA, be sure to sign up for the MOAA newsletter and like and subscribe to this channel.
And don't forget to engage in our Summer Advocacy in Action campaign, where you can meet with your lawmakers while they're back home in the district. To get more engaged, visit the links in the comments below. Thanks, and we'll see you next week.